morning, doctor.
Hi,
Good morning, ladies. We're here at Bud Cosmetics Center with Dr. Osaka Malepo. And we want to do this live video so we could answer all the questions that the ladies have
Sure.
for the doctor.
Sure.
And we're going to talk today about tummy tucks.
Tummy tucks.
It's abdominoplasty, correct?
Exactly. The medical term for tummy tuck is called an abdominoplasty, which is basically, as you know, an operation that is very popular. It is a very effective way of changing the contour of your tummy, of your stomach. It makes your stomach very flat and your waist a bit smaller than it is now.
Most of the patients are the people that do this kind of surgeries because they've lost a lot of weight or after having babies, or just because they have extra skin hanging and they choose to do this kind of surgery.
Exactly.
What's an extended tummy tuck, doctor? I hear a lot of doctors, they said, oh, you need an extended tummy tuck, or you need the whole 360 body lift.
Right. So you bring up some very good points. A patient that's a good candidate for a tummy tuck is one that has loose skin, usually that's hanging. That's very common after C-section or having had some babies. Also, patients whose stomach sticks out because the muscle has been stretched out during a pregnancy. So a tummy tuck does two important things. The first important thing it does is it takes the muscle and make it look like you're sucking your stomach in all the way. Okay? The second important thing is going to get rid of all that loose skin, and it does it with low bikini skin. Now you mentioned this an extended tummy tuck. An extended tummy tuck is when the incision goes a little bit longer. Basically, you have your hip bones, and the incision has to go around the hip bones. We call it an extended tummy tuck because the incision is extended.
So doctor, what's the difference? We have a lot of patients that say, oh, I need a tummy tuck, but I only want the doctor to do a mini tummy tuck, a little incision.
Yeah.
Is that possible? Sometimes patients have, what about the extra skin hanging on the side?
We take it on a case-by-case basis. So there's a mini tummy tuck, a standard tummy tuck, some people call it an extended tummy tuck, and also a circumferential, or the sort of 360 or tummy tuck that goes around like a belt, so some people call it a belt lipectomy. And it's this is for patients that have lost massive amounts of weight, that have had a gastric sleeve or a lap
I
band.
recall a patient that
Right.
we did that
Yeah,
I
we
was
do that pretty
there.
often, right? So a patient that loses a massive amount of weight, they're left with a massive amount of loose skin, so you can do a circumferential tummy tuck. So like you said, there's a mini tummy tuck, a regular tummy tuck, an extended tummy tuck, and a tummy tuck that goes all the way around, depending on how much loose skin you have, and we take it on a case-by-case basis.
What about doing tummy tuck and lipo at the same time?
Well, they're often combined. Liposuction is a good adjunct to doing a tummy tuck because there's often little pockets of unwanted fat, especially in the flanks or glove handle, that we can contour at the time of doing a tummy tuck.
So you could do a tummy tuck and you could do lipo in which areas? The waist, the flanks?
Again, it really depends on what you're presenting with. So if you're presenting with some isolated pockets of fat in the flanks, then we can do that at the same time as the tummy tuck. But if you need lots of liposuction, it's better to separate that from a tummy tuck. So
Can you combine tummy tuck with breast lift and breast augmentation?
absolutely. It's a very common combination.
Mommy makeover.
Mommy makeover, exactly. The breast lift, breast augmentation, sometimes even breast reduction in combination with the tummy tuck is what we call a mommy makeover. It's a very effective, good operation if you're the right candidate for it.
What about, doctor, can you do tummy tuck and facelift at the same time?
Anything is possible. I wouldn't recommend it. You have to be somewhat judicious in what operation you want to combine. Generally speaking, the facelift should be done separately. Then, it is surgery, and there's a significant stress on the body. So we try to limit how many operations we do at once for time factors, for safety reasons. A lot of times you can stage these operations with about anywhere between 3 months in between each operation.
What about arm lift, doctor, and thigh lift?
Yeah, the extremities that people often neglect those other parts of the body. Most people are focused on the tummies or the breasts, but the arms, are also people get very subconscious about arms, especially here in South Florida. A woman wants to wear a nice sleeveless dress like you, and if they have big arms with a lot of fat, or it hangs like this, and they have all this like bat wings that can flap.
I don't have that.
You're pretty muscular. But if you have a lot of loose skin under here, you know, an arm lift is a good operation. And it has there are two ways to do that. You can have one with a very short incision in the underarm, or a very long incision that goes in the elbow. But when you have your arm to your side, no one can see that you have
What
it.
about keloid, doctor? You know, a lot of patients are concerned about when they're doing their arm lift, if they're gonna keloid, because this is scar, something, like you
It's a
said,
very
there's
long scar,
it's
yeah.
a long, very scar, so what about the keloid? Can you keloid on the arms?
Sure. I mean, now scarring, as a plastic surgeon, we try to minimize scarring and place scars in places where they're not noticeable. So we try to hide the scars in areas where they can't be seen, either under the panty line or in the underarm or in a natural fold of skin. And scarring is always a concern, especially with plastic surgeon. You want to try to minimize it. So there are things we can do in the operating room to try to minimize scarring with proper technique and being very, very gentle. And then the thing that the patient can do afterwards to try to minimize scarring. Certain creams, certain creams that contain silicone can help scar. Compression can help the scar. But nevertheless, people sometimes still develop what's called a keloid scar or a hypertrophic scar. And that has to depend on, there's certain genetic factors. The African American, the very dark Hispanics are more prone to getting keloid scars. And then we can do certain things, but a lot of times scarring is not completely in a plastic surgeon's control, although we do everything we can to make sure that the patient has the least noticeable scars possible.
It could happen, the keloid in your breast when you do breast lift?
Yeah, absolutely. I mean, keloid scarring is more of a genetic issue than a technical issue, and it's really if you're genetically more predisposed to getting keloid scars because you have a very vigorous immune response to injury, and then you can get keloid scars. But usually very few scars that we can't make better, either with steroid injections or reviving the scar, making sure the scar is not under too much tension. Tension can make the scar become hypertrophic. So there are certain things that we can do with plastic surgeons to make the scars less noticeable. And keloid scars is always a concern, but there's certain parts of the body that are more prone to keloid scars than others. For instance, the breast is very unlikely to get a keloid scar, especially in the vertical. But the sternum, the middle of the scar, your upper back, your shoulders, these are places that are more prone to getting keloid scars than others. So the arm and the breast, which generally speaking is unlikely for you to get keloid scars.
Doctor, we've been getting a lot of patients that you had done surgery before that they want to continue having surgery with you. As a matter of fact, yesterday we had a patient that you did the video and she came back for the breast augmentation and she's coming back again. She says she wants to do an arm lift.
I think that's a good sign. You know, I mean, patients who are very happy with the results often come back for a second or third procedure within the first couple of years, and even 10, 15 years later they may come back. So I'll do a breast aug on a middle-aged woman, and they may come back 15 years later and want to do a facelift or something. So there's always room for improvement, and I think it's a good sign of happy patients. And
Absolutely.
When they come back and oftentimes they'll send their sisters or their co-workers, and I mean that's why
Well,
we're
it's
so
good to have a relationship with your patients. You have to be nice. You have to treat them like they're your family, because those patients are going to bring you more patients and friends,
Absolutely.
and that's how you're supposed to treat everybody.
I think here at Bob we have a good reputation for treating our patients very well, and we're a small family-owned business, so we take care of all our patients. We make sure that they're treated like one of the family, and that's why we're so successful.
And we're joint commission, which is very important.
JACO accredited.
JACO accredited, yes.
So,
it's very important for the patient's safety.
Safety, and you can be sure that all the paperwork and all the supplies and all the emergency procedures are in place.
Very important. It's not about how much money you're paying for the surgery if you don't have a safety place to do your surgery, and the right persons to work and the place and everything. Well, ladies, once again, we're here at Buck Cosmetic Center with Dr. Osaka Molepo. You could call us if you want to book your next surgery at 305-774-6151, and you can call as well. You could do FaceTime with the doctor. He's here Monday to Saturday. He's always available. He lives in Florida. He doesn't live out of town. And he will always answer the phone calls, the texts, FaceTime. He likes to text actually patients directly. He likes to have patient communication, which is very important, that your doctor gives you your number, that you be able to talk to your patient know how she's feeling, see the patient the next day is very important as well.
Yeah, communication is probably the most important thing. So I'm always available, like Naomi said. And if you're out of state, you can definitely do a video conference if you want to have if you have some questions for me, you want to do a consultation with me. There's no replacement for meeting you one-on-one, but if I know a lot of my patients come from all over the country, really.
Correct,
So
yes.
video conferencing is something that we offer here, and I'm happy to speak to you at any time.
Doctor, what's your BMI? I want the patients and the people that are on Facebook, listening to us. I want to know your BMI. What's the max you go on the BMI for patients who have surgery?
So you may not know what a BMI stands for, body mass index. It's a ratio of your height and weight. And for outpatient surgery, which most of this is, meaning that you're not staying here in the facility, it's outpatient surgery. So you have your operation, and you go to a recovery house or under someone's care. So we do have a criteria. A lot of people have a criteria of 35, which is the ratio of your height and weight, a BMI of 35. I like my patients a little bit smaller, so I have a BMI of 34. So a body mass index of 34 or less is usually my criteria for having surgery.
Okay, that's good to know. And the hemoglobin has to be in the normal range.
We want healthy patients. So if you have a lot of medical problems, diabetes, and uncontrolled high blood pressure, then you really need to get that taken care of prior to having elective cosmetic surgery.
Which is very important because these patients, they waste a lot of money traveling,
Right.
coming from out of town, and
You gotta remember,
not cheap.
it's not cheap, and this is not what it is surgery to improve how you look, to improve your confidence levels, to make you appear more sexy if that's what you want. But number one, health is first. So if you have like medical problems like diabetes or high blood pressure, definitely that should be your priority.
Now we have all the incommon holidays, and a lot of people want to look skinnier, have the small waist.
Yeah, Thanksgiving's coming up.
Yeah, Thanksgiving. A lot of people eat too in the holidays.
Right.
And then we have income tax coming out. We're pretty busy and booked
This
out.
is a very busy time of the year for us.
I remember last year with you, we were
Wow.
super busy. We worked on to
We worked-
very late
yeah,
hours.
we worked a lot.
I was
And,
mad at you sometimes because
yeah,
we worked
of
too
course.
many hours.
But
But ladies, this is a wonderful doctor. As you could hear, he has great manners. He likes to speak to every patient. You should come and meet Dr. Osaka Molepo. Once you meet Dr. Osaka Molepo, you're going to book your next surgery with him. So once again, we're here at Coral Gables at the Cosmetic with Osak and Naomi. And I'll see you later. And please call us at 305-774-6151 and book your next surgery with Dr. Osaka Molepo.
very good.